All right, so let's talk about breathing. Why does it matter how you breathe? So whenever you take a nice deep inhalation and exhalation, you create something called intra-abdominal pressure, or AIP. And what this does is it's kind of like a vacuum. Whenever you turn on those old school vacuums, you kind of fill that balloon. Well, it's the same thing happens in your abdomen and in your thorax. So you're creating this pressure canister within your torso. Why that matters is because you want to make sure that that expansion is happening exactly how that vacuum bladder expanded. You want to make sure that it's expanding in all directions. So a lot of us, we tend to breathe or we breathe into the abdomen forwards, or we just breathe with our upper body instead of allowing the ribs to move and the belly and back to move. So it matters how we breathe, because say if we're always putting a lot of pressure maybe in on the abdomen and we have diastasis, guess what? That's actually going to inhibit our chances of healing properly after having baby. Or we have chronic head and neck pain, headaches, lower back pain. So if we are having those problems, guess what? That's because there's all that tension and pressure being placed against those muscles and extra work happening where it doesn't really have to happen to work. So you don't really have to have that extra work happening if you kind of start to rethink how you breathe and focus on breathing better, more effectively, spreading out that tension, spreading out that pressure to maximize results and perform better.